Hello and a very warm welcome to the brand new edition of To The Point. I'm Kriti Mishra. And on today's show, I have with me Director of All India Institute of Medical Sciences, Dr. Randeep Guleria. Dr. Guleria, welcome to Rajya Sabha Television and thank you so much for joining us.
Thank you.
So first things first about lockdown 4.0. How important is this lockdown for breaking the chain of coronavirus?
So I think this lockdown is very important for two reasons. One reason is that it's given some freedom as far as economic growth is concerned, but with that freedom comes responsibility also. And it's important for all citizens to realize their responsibility, whether it's going out wearing a mask, whether it's social or physical distancing, or whether it's regular hand washing. At the same time, it has put some restrictions in place, like the metro or the air travel, so that we can prevent the chain of transmission and not have a surge in number of cases. The focus, of course, has to be in the red zones or the containment areas, because that's where bulk of our cases are coming from. And if we can actually prevent the increasing number of cases in these areas, we will actually be able to decrease the number of cases in our country, and at the same time allow some degree of the economy to restart.
So India's response has been proactive, preemptive, and graded. Government says the focus now is to reverse the curve of coronavirus. What is your assessment on the spread of the infection?
Now the challenge is to see, can we now work on decreasing the number of cases? Can we work aggressively now towards not only flattening the curve but making the curve go downwards, and at the same time working aggressively to decrease mortality? So protecting our high risk groups, that is the elderly, those with comorbidities, and making sure that they don't get sick and really cause a problem in terms of higher death rates. So I think that is the subsequent challenge that we have in the coming days.
But so if the increase continues, what sort of health challenges do we see in the coming months and how do we overcome them given our medical and health infrastructure?
So if we continue to see increasing number of cases, it will indirectly mean that there will be increased strain on the hospitals. So we have to start getting our hospitals totally ready. We have to have things in place, and we have to see how can we focus or redistribute our resources in those areas where the cases are becoming more and hospital requirement will be much more. Remember, there are large parts of our country where there have been very few cases or the cases have started coming down. So we need to see how can we sort of reallocate our resources to those areas, the so-called hotspots or the containment zones, where there is going to be an increasing need for health resources as compared to other areas which are relatively stable and the cases actually are coming down in these areas.
And how can a sudden surge be prevented, sir?
The sudden surge can be presented by two or three mechanisms. First mechanism is by people realizing their responsibility and very strictly following physical distancing, staying indoors, and especially being very careful in the containment areas. The infection will happen or the surge will happen if there is a leakage from the containment areas to the green zones or to the safe areas. If the containment areas are kept closed and we are able to do a lot of contact tracing there, those who are positive are put in an isolation facility and we are able to break the chain of transmission, and we don't allow people to go out from there to infect other areas, then we should be able to actually decrease the number of cases and bring down the rise that's happening right now.
We have also massively scaled up testing in our country. But how do we make it more sustainable given our population?
So considering our population, we have to have a testing strategy which is doable, which is practical, and which we can achieve. Our population is very large. So even if you say we would test 5% of our population, that comes to something like 7 crore people. And that is something which cannot be done even at a global level. I don't think even if we were to look at the entire world, we would not be able to do that many tests as we are talking about. So the testing strategy has to be focused to answer the questions that we need to help us decrease the number of cases, decrease mortality, and as we're saying, bring down the curve or flatten the curve and make it show a downward trend. So focused testing strategy in the hotspots, at the same time surveillance in the cold spots to see that there is no surge of cases in these areas has to be the way forward.
And as you mentioned that comorbidities become even more fatal combined with COVID-19.
Yes, so there are two or three things. One is that if we look at the younger age group, people less than 50 years, the mortality is very low. Majority of people have asymptomatic or mild illness and they recover without any treatment or with very minimal treatment. But as the age increases or as comorbidities get added to these age, and these includes hypertension, diabetes, heart disease, chronic respiratory disease, people whose immunity is low, or people who are on dialysis or have an underlying malignancy, these individuals have a higher risk for developing a more severe infection. In most cases, COVID-19 just causes an upper respiratory or flu-like syndrome. You have fever, body aches, a cough, a sore throat, and it lasts for a few days and you become all right. But in these individuals, this flu-like syndrome from the upper airways goes down into the lung. It causes pneumonia. It causes systemic manifestation, which leads to increased clotting, and this leads to a higher chance of having clots not only in the lung but in the brain, and also causing effects on the heart, and therefore their morbidity and mortality goes up. So this is the population that we need to really protect and look after, because if we have to decrease our mortality, and I think that is the most important thing, that we have to decrease the death rate, we can do it only by protecting our high risk population.
Also, sir, talking about the virus, scientists across the world have identified over 200 genetic mutations in the SARS-CoV-2 virus that causes COVID-19. What does it tell us?
So all viruses are known to have a little bit of genetic mutation that is part of the viral structure. The issue, of course, has multiple factors that we need to consider. One is, are these mutations actually significant, or are they minor mutations which really have no effect? The argument is that there may have been some mutations which make the virus less virulent or more virulent, and therefore it may lead to higher mortality or lesser mortality. And there is this argument that probably the strain in India in certain parts may not be that virulent, and that's why the death rate is less. But more importantly, it also has a bearing on the vaccine that we make, because the vaccine is against a particular strain of the virus, and it is effective if that strain is there. If the virus changes significantly, the efficacy of the vaccine can also come down. So I think it's important to keep monitoring how the virus is behaving, and our treatment strategy and our approach in terms of vaccine will also change according to how the virus changes over time.
So, two questions stem from the answer that you've given to me. One, do you think that dominance of a particular type of strain of coronavirus could be the reason behind the surge in the symptomatic cases that we see?
It's whether there is a change in the virus that we're seeing here is a difficult thing to answer, because we don't have enough data right now to say one way or the other. We are seeing less mortality as far as India is concerned, but there can be many causes for that. We are a younger population, that is one. Secondly, there's an argument that we all get BCG vaccination, and there is some data which suggests that BCG vaccination actually provides some degree of protection, and maybe that's why we're not having that many severe cases. But like you said, it could also be a different strain of the virus which is circulating as far as India is concerned.
Secondly, sir, there are scientists who also hold this opinion that the virus is comparatively stable, so it will be possible for us to have a stable vaccine in the long term. Would you agree?
Yes, so it's possible that if we look at certain parts of the virus and we develop a vaccine against that part, and that our immune system responds to that, we should be able to get a vaccine which will be stable. Now remember, there are certain viruses like the influenza virus which changes more rapidly. It has what we call an antigenic drift and an antigenic shift. And because of that, we need to have an annual influenza vaccine. Because every year the vaccine changes, the virus changes, and new vaccine has to be made. On the other hand, there are other viral infections for which the vaccine is sustainable, for which we don't need to give it every year. This could be related to the polio vaccine, which is again a viral infection, or other infections which we see. So a lot depends on what is the chance of the virus changing too much. As of now, it doesn't suggest that COVID-19 really has a dramatic shift in terms of us requiring to really see that there may be a dramatic change as far as the vaccine is concerned.
Sir, since you're talking about the vaccine, across the world, over 100 vaccine candidates are racing against time. Where do we stand in terms of developing the vaccine, and what kind of role do you foresee for India?
So I think India is playing a lead role as far as vaccine development is concerned. There are various institutes in India, private and in the government sector, which are collaborating. not only with Indian partners but with international partners. There's the Serum Institute of India. There are other institutes like Cadila, which is partnering with various institutes like the Oxford Institute, institutes in New York, trying to make various types of vaccine or looking at various vaccine candidates. These vaccine candidates could look at an inactivated or a vaccine, which is an inactivated virus, which could act as a vaccine for immune response, various RNA or DNA nuclear vaccines. They could also look at the particle of the vaccine, which could particle of the virus, which can act as a vaccine, which is known as the VLP, the viral-like particles. So a lot of basic research and vaccine-related research is going on. And also there is in parallel mechanisms going on that if we do get a vaccine, how can we scale it up for mass production? So remember, whenever you have a vaccine, you first have to develop a vaccine candidate which you find is you think is effective. Then you have to go into human trials to see that does it really produce good amount of immunity in an individual. Because if you have a vaccine which is not that immunogenic, it doesn't give good amount of immunity, the vaccine is just no point. If the vaccine only gives you 20% protection, it's not really of any point. If it gives you at least 70 to 80% protection, then it's worthwhile to have that vaccine. Then the next step is to say, make sure that this vaccine is safe. You have to have a vaccine which is safe because you are injecting this to normal or healthy people, and therefore it has to be a safe vaccine. And there have been times in the past where vaccines were made, but it was found that it was causing side effects, especially neurological side effects. Once these two steps have been done, you have an effective vaccine, you have a safe vaccine, then you take this to see how can we do mass production and produce millions and millions of doses. So this whole supply chain takes time. It takes usually many years. It's being now fast tracked, so it could take about a year or 18 months. So one is very hopeful that a vaccine should be available to some extent by early next year, but only time will tell whether we get an effect at that time or it may take another 6 months.
But sir, then equitable distribution again remains a challenge.
Correct. So for all vaccine which come initially, you have to prioritize as to whom should you vaccinate and whom can you vaccinate later on. This becomes a huge challenge. This was a challenge when initially we had the H1N1 pandemic and the vaccine came and only limited doses came to India as part of a global distribution. And then one had to prioritize that who is the high risk group whom should be vaccinated and whom can we sort of wait and give the vaccine later on.
Also, Dr. Guleria, there is an augmented demand of various types of diagnostic tests by countries across the globe now. What kind of deep tech innovation do we see and what will it drive?
So currently the test that we have is the RT-PCR test, which is a PCR-based test which picks up, diagnoses the virus from the nasal and throat swab. There are other tests which are available which are now the antibody-based test. If you have the infection, then the first part is the virus stays in your nasal passages in your throat, and that's how we pick it up with the nasal and throat swab. But after a few days, the body reacts and starts producing antibodies against this virus, and they are in the blood. And therefore, if we do a blood test, we pick up the antibodies. Now, these antibodies may occur after 10 days, it may occur after 14 days, depending on the immune system of different individuals. But this tells you that the body, you have had the infection, and these antibodies stay on in the body for a few months. So even if you had the infection some time back, your antibodies will still be present, and this will tell you that you had a past infection. But what we really need is a point of care test. Can I really look at a person and take a drop of blood and put it in on a small on a strip, and will that tell me that this person is infected or not? And that will really be very useful because that will help you to decide your treatment strategy and whether this person needs to be isolated or not. So there are various kits which are what we call antigen and antibody based, which also look at the antigen, which is the initial part of what the virus has, and antibodies also. However, they need to be validated. We need to see that they are sensitive and specific enough. But what we are really looking for is a good point of care test, which at the patient's bedside can give us a definite diagnosis within 15-20 minutes or half an hour. This will actually be a game changer and be very useful as far as patient care is concerned.
And what's your take on COVID Kavach ELISA?
So COVID Kavach ELISA is basically an ELISA-based test, which is basically trying to again look for antibodies. It can be done as a part of surveillance, and this gives you an idea that this area or this individual has had the infection, and now he is immune to some extent or protected to some extent, and therefore one can be sort of reassured that in this area the chance of resurgence of the infection is less likely.
Dr. Guleria, we're talking about the new world, a new normal. How do we get accustomed to this new normal?
So that is going to be a big challenge. How do we really get accustomed to the new normal? Because the new normal is going to really make social life very, very difficult, and it will make social life more like a virtual social life. So if you're looking at things like partying, if you're looking like big marriage parties or big social gatherings, for many months or so quite some time, those will not happen. We will have to really have physical distancing regularly when we go out, wear a mask, and get into the habit of regularly washing our hands. Also, crowded places like crowded shopping malls, crowded cinema halls, or other crowded activities like a cricket stadium full of fans during a cricket match will be something which will become more and more difficult, because that will actually be a problem in terms of the infection spreading. So these are things that we will have to adjust to. I'm sure with a lot of technology available, with a lot of social media and other ways of actually being able to stay in touch now, which we didn't have 10, 15 or 20 years ago, it will be to some extent easier than before for people to really adjust to this new normal. But it's going to be a big challenge, because not only is it going to be in terms of social activities, but for us as a university to teach doctors for training, it's going to become a big challenge. We will have to look at e-platforms of training. We can't have a classroom with full of students who are just sitting next to each other. We will have to look at new strategies of having graded ways of sitting, or maybe overflow rooms and divide classes into two parts, whereas half the students sit in one area, and through sort of teleconsultation, telemedicine, we give the talk on the other. They are able to hear the lecture in the other room, so that there is social distancing is maintained. So a lot of areas, whether it be education, whether it be service sector, whether it be the hospitality sector, or whether it be just normal social activities, will change because of this new normal.
Dr. Guleria, that's a very important point and a very legit point that you're making. Before we end this conversation, two quick questions. Your suggestions to the states planning their exit strategies.
So my suggestion is that we must make sure that there is responsibility as we go towards the exit strategy, because we cannot afford to have a resurgence of cases once we start having an exit strategy. That will be actually very, very harmful, and it will cause a huge increase in the hospital admissions, and will actually further cause a problem as far as the economy is concerned. So whatever exit strategy we think of has to be thought through properly, and has to have a lot of responsibility in terms of the citizens, that we make sure that they are able to maintain the issues of social distancing, preventing the chain of transmission, and based on that, a graded or a slow approach may help in terms of making sure that while we start gradually opening up, we are able to monitor very closely that there is no increase in the number of cases, there's no resurgence in the number of cases, because that could be counterproductive.
Point well taken, sir. And your take on post-corona world?
So my take on the post-corona world is going to be that it's going to be a totally different world. We will have to really work with a lot of new strategies. We will have to be innovative, and I think this is also a time for India to really look at it as an opportunity, especially as far as the area of science is concerned and medicine is concerned. We also have to look at it as an opportunity of looking at how we can become leaders in producing medical products, in science, in research as far as vaccine is concerned, and look at this as an opportunity in the global platform for a large number of our industries to grow. At the same time, it's also a challenge to be responsible citizens. We have to understand our responsibility as citizens, because if we do that, then not only do we protect ourselves, we protect our family, we protect our neighbors, we protect everyone else who is in our society, and by doing that, we are able to win the fight against COVID-19.
Absolutely, sir. On that note, Dr. Gulerias, thank you so much for joining us and speaking to Rajya Sabha Television, sir.
Thank you very much.